Our big focus, the numbers and the variants. Today, India recorded 53,476 coronavirus cases, the highest daily rise since October 23rd. With 251 deaths, the toll has risen to 1,60,692. Now, on Wednesday, the Union Health Ministry had said that a new double mutant variant of coronavirus and variants of concern had been detected in 18 states in India. Some are the double mutated variants, then there are other novel variants that have been detected. An analysis has also found 771 internationally known variants of concern as well. Those are the UK, Brazil and South African variant. The ministry, however, so far has said that the new strain has not been found in sufficient numbers to establish or to explain the rapid rise in cases in some states. So as of now, there's no connection, they're claiming, between the surge in cases and the discovery of these mutated variants. However, more study is required. So what is different with these variants? So far, we only have anecdotal evidence. In Maharashtra, some doctors are claiming that while it seems to be spreading faster, the illness this time is milder and shorter. Again, this has to be proven. In Karnataka, there are concerns that more children seem to have been infected in the second wave of coronavirus. An increasing number of children aged 1 to 10 are coming down with COVID-19. But what's leading to this? Is it because of the infection, or is it just due to more laxity after cases came down? And early this year, we've seen people have become more and more lax. So from that, it's logical that more children will also get infected as more people get infected. Well, to talk about all this, we're joined by Dr. Alok Roy, Chairman, Medica Group of Hospitals. Thank you so much for being with us. Dr. Prakash Vemgal, Director, Department of Pediatrics, Rainbow Hospital, Bengaluru, joining us as well. Dr. Alok Roy, I'd like to ask you first regarding, we're seeing the cases exploding again. I think now it's pretty much confirmed that, yes, indeed, we are in this second wave of the pandemic. Also, the discovery of the mutated variants. This is something that, again, many experts had expected and suspected, and now it has been confirmed by the government. But so far, the government has not said that, these new variants are leading to the surge in cases. That link still has to be drawn.
Thank you, Gargi. I think what we have found out so far, that variants of concern, VOC, what they call it, have been in a very limited cases. They have got just 206 cases in Maharashtra, whereas Maharashtra has around 30,000 cases. So as compared to the new variant, the number of cases are not that high. I think what looks like that there is a variation, there is a variant. Variant is a natural growth of a virus. It happens with every virus all the time. Virus keeps on changing its nature, but does not mean that this virus is causing a disease. I think the sense which is developing, that we have 53,000 patients almost, as you have said, same number of patients we had on 18th October and on 17th August this year. But then the number of patients who were sick or active were much, much higher. So we have much less active cases. We have just approximately 4 lakh active cases at this point of time. Whereas in October, we had 8 lakhs cases active and much more in August. So it looks like that this what is happening today is more because of the laxity, because of we have really thrown the caution to the wind rather than new variant. Very, very unlikely to be the new variant just causing this kind of infectivity.
All right. So we still need, of course, more studies to be done and, more samples to be studied, because, as you said, it's just a handful so far, and just below 1%, I think, has been analyzed for the variants. Dr. Vemgal, in Karnataka and Bengaluru, especially, a worry as they're saying that more and more children are, being infected by the virus. But this again could be explained by laxity and just the numbers going up.
Thank you very much, Gargi. So basically, when you look at what has happened over the last couple of months, as rightly mentioned, probably the new variants are not the cause for this new rise in number of cases in Karnataka as well as in Bangalore. Probably it's a kind of, I could probably say that it is probably the previous strains as well as the new strains. But we don't have a definitive mechanism to identify the new strains in a larger population. And having said that, I work in a children's hospital. We are getting a number of patients, the pediatric age group, with a lot of cold, cough, fever, vomiting and loose motion over the last month. And when you look at most of them are settling down within 2 to 3 days. So if you look at those babies, we are not doing COVID tests to all of them. Only if they become quite sick and they continue to have some medical issues, then we try to do COVID testing. And when you do the COVID testing, it's a kind of a straightforward PCR test where we are not able to differentiate whether it is the new strain versus the previous strain, what we had. And at the same time, all the major cities have opened up. The schools have started in Karnataka over the last 3 months, and all these factors may be contributing to the rise in number of cases.
Right. So, Dr. Alok Roy, don't you think the need of the hour is to do more aggressive genomic sequencing of, the positive cases, because it's taken us this long, to arrive at what, again, I'm saying what many suspected, that we do have indeed these variants. There's a double mutated virus, and that of course sounds very frightening, but we need to know more about this. We need to know whether they're more infectious, and given that, we're producing vaccines at this rapid rate, we're doing testing, etc. Why can't we also do this genomic sequencing so that we can know more and study this more aggressively and quickly?
Obviously, Gagi, the more tracing is important. Tracing of all kinds, of the kind of problem, whether we have got RT-PCR positive, also what kind of genetic sequencing it has. That will certainly help us in looking and finding out whether it's a VOC, variant of concern, or variant of interest. Also, it will help us in earlier tagging it, whether this will respond to the immunity booster vaccine we are giving, whether this is a more infective, whether this is will cause more severity of disease. All that will be clearly established if we can do more genome sequencing. That would always help us. But the issue is, do we have the availability of such resources at this point of time? Everybody can't do it. It has to be done in a few limited labs. That's a limitation.
Right. And Dr. Vemkal, as you were saying, the need of the hour is for people to continue with the COVID protocols, but that's not what we're really seeing on the ground. People are becoming very careless here at NDTV. We've been, highlighting this issue of COVID, even when the numbers were down, that you have to remain on your guard. But, it's just talk. Even authorities are talking, but on the ground, people are in a festive mood right now.
You're absolutely right. It's kind of a thing which people have to become very sensitive, and it is going to stay with us for a long time. So in the hospital, we still continue the same protocol. The parents who come in, the children who come into the hospital are taken care in the right way, what we did last year. And that has shown that the number of cases came down quite dramatically for the last, later part of the year. But if you relax over the next couple of months, with the new mutant variant plus whatever is the pre-existing virus load would probably double up and triple up. And whether the vaccination itself can cause probably stop this further spread of this virus to the community is a questionable thing.
Right.
And whether these mutants are going to have less virulence in the community, and especially the children, is a thing which we need to see further. So, what we saw, the first mutant, children didn't become much sick. Very less than probably 2 to 3% of them had to get into ICU admissions. Out of that, probably around 1 to 2% required mechanical ventilation.
Right.
So what I would probably look into it to see how well we can still follow the same protocol, maybe for the next 1 year or 2 years, to contain this virus.
All right. Thank you so much, Dr. Vemkal and Dr. Roy, for joining us on the show and sparing your time.
Thank you very much.
Well, the other big focus, the latest controversy to hit Astrazeneca. Astrazeneca said its COVID vaccine is 76% effective in the new analysis of its US trial. That's a tad lower than the level in an earlier report this week, which was criticized for using outdated data. The interim data, which was published on Monday, put the efficacy rate at 79%, but had not included more recent infections, leading to a highly unusual public rebuke from US health officials. Well, to talk more about this, we're joined by Dr. Fahim Yunus, Chief of Infectious Diseases, University of Maryland and Upper Chesapeake. And of course, we're going to talk more about COVID, but first and foremost about this entire controversy. Dr. Fahim Yunus, do explain to us, AstraZeneca came out with this press release, and then there was a rebuke from a US agency, creating more doubts and controversy.
It's too early to know all the details, but I believe it's a good vaccine and bad communication. So if you ask me how it's going to end, because we know so much about the trials of Astrazeneca, we know the phase 1, phase 2 studies, we know the early data from UK, South Africa, and Brazil. I believe it's a good vaccine. It's just bad communication and too much pressure to compete right now. Everybody's focused on an efficacy number because Moderna and Pfizer have set a certain standard at 95%. Any vaccine, and these are just my words, this is just my understanding, I could be wrong, but I think anybody who's in the 60s or 70s, they just feel like somehow they have to bump up their numbers, but that's not the focus. The focus is, or it should be, what is the impact on hospitalizations and deaths? And most of these vaccines are really good and quite tight there. So let's just wait how it comes out in the next few days.
Now, in India, we've, announced that new variants of coronavirus have been discovered. And of course, all of you doctors have been saying that there's nothing unusual. Viruses do mutate, but the worry is whether they're more infectious.
Exactly. I think variant is the new buzzword in this pandemic. And most people don't understand that this is just like any other virus. mRNA, RNA viruses mutate all the time. Having a variant more prevalent, I don't think means anything. What means is the variant different? Is it more transmissible, or is it more fatal, or is it going to evade immunity, as we say? And a lot of science has to go in before we can definitely say those things. For example, as far as evasion of immunity, I think my litmus test would be when we truly have someone who's fully immunized 2 weeks after the second dose and then gets a variant infection, or someone who's recovered from COVID and then gets a variant infection. Once we see those cases, I think then you can be sure that this is something of concern. That's not to say we don't work ahead and we don't plan ahead. I just think there should be separation between what happens in scientific communities and academia and boardrooms compared to what happens on media. So I don't think an average person should be overly concerned. It's the same method of prevention of social distancing, masks, washing hands, avoiding indoor spaces, and that's what we should focus on.
Right, but the concern with variants, at least among the public, is also about the effectiveness of the vaccine. And here in India, we have two vaccines. Of course, Moderna and Pfizer have come out and said that they are effective against the variants as well.
Sure, I believe that whichever vaccine you can get, you should. There is more studies and a little bit more data with Pfizer and Moderna that they may have more efficacy proven against the variants. But the reality is we make choices in life all the time. If you look at all your friends, they're all driving different cars. Some are more expensive, some are less expensive, but they're all safe and they're all getting you from point A to point B. And I think at some stage we need to bring that sort of practicality to a pandemic. Let's just look at what gets us from point A to point B and not worry about the fancy stuff. If particularly it's not available to the masses, it's only going to generate pessimism and more discord.
Now, there have also been cases of people getting both doses of the vaccine and then developing coronavirus. And of course, these are anecdotal cases, but there is some concern. We get a lot of questions about that. What can you tell us?
That's a great question. I can't talk of every vaccine because I don't think we have enough data on every vaccine. So let's just say hypothetical vaccine X that has efficacy of 90%. What that means is that 90% means 1 out of 10 people who's vaccinated will still get the virus. So it should not be a surprise. And when you project that 10% to a population of 1 billion people, right, that number is going to grow exponentially. It's a big number. Once again, what people should focus on is not that whether after vaccine they got corona. The question is whether after vaccine they got corona and got hospitalized or died. If they had a bad outcome, I think then that is a matter of concern. If they just had sniffles and got better, actually that's why the vaccine is there for, to dampen the impact of the disease. So to sum it up, a small percentage will get these infections. We should focus on what is the outcome. As long as their outcomes are good, it actually proves the point that vaccines are good and they prevent severe disease.
All right. Well, thank you so much, Dr. Fahim Yunus, for speaking to us here at NDTV again. And with that, time for us to slip into a short break. On the other side, we'll take a look at some of the coronavirus forecasts for India. India today reported 53,476 new COVID cases, and that's the maximum that we've reported since October last year. 251 deaths have also been reported in the last 24 hours. So we're well and truly in that second phase of the coronavirus peaking in the country. And let's just take a look at the top 5 states. Maharashtra remains the big worry. Remember, Maharashtra is leading the numbers, reporting 31,855 cases. This is the highest they've reported since the start of the pandemic in any of states of India. This is the highest number that has been reported since the pandemic began. Punjab, Kerala, Karnataka, Chhattisgarh also all reporting over 2,000 cases each. So there you can see Punjab reporting 2,613, Chhattisgarh reporting 2,106. Let's take a look at the states with the highest number of deaths in the last 24 hours. And again, Maharashtra with 95 deaths, reporting the maximum number in this last 24 hours. Punjab reporting 39 deaths, which is very worrying as well for a state like Punjab. Chhattisgarh 29. Tamil Nadu and Karnataka have both reported 12 deaths each in the last 24 hours. Well, let's take a look now at the Maharashtra curve and just see. This is from the start of the pandemic. This is from March last year, and just look at how the curve went up. But now you can see it's gone even higher. So the number of cases reported, as we said, 31,855, which is the highest that has ever been reported in Maharashtra since the start of this pandemic. It had come down there in the beginning of this year, but now it is going up again. So it's well and truly into that second peak, second wave of COVID. And take a look at Gujarat as well, which has reported the maximum number of cases they've ever reported since the start of this pandemic, 1,790 new cases in the last 24 hours. Before this, the maximum they had reported was 1,735 cases. And again, you can see the numbers have gone up from the peak earlier. This was the peak. The numbers had come down in the number of cases, and now it has gone up again with 1,790 cases being reported. Well, let's now take a look at the COVID forecast that has just been released by the SBI Bank. And they have said that the COVID infection will last. The second wave could last for 100 days. And this graph indicates the forecast of the peak in the second wave, which is based on a trend till the 23rd of March. So there you can see the second peak here is what they're predicting, and it will come sometime in April. So we are well and truly into that second wave of coronavirus, and they've said that the peak level will be reached in around 100 days is when this second wave of coronavirus will last, and that peak will come in the second part of April. So there you can see, and they predicted it's going to be lower than the previous wave that we've seen in the country. So fingers crossed that indeed that remains the case. And finally, as a warning to all of you and to continue, practicing social distancing, etc., and all COVID protocols. Here's a caricature that was made by a banker, Rajiv Banerjee, in which he, took inspiration from the recent viral video in which they talk about having a party, and he says, "Ye hum hai." This is the coronavirus over here, and this is the mutant viruses, and here they are having a party with all the people over here. So really a warning to everyone to just remain alert and continue practicing all those COVID protocols, because COVID is indeed among us. Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.